diaphragmatic contraction with closure of the glottis, terminating inspiration. This is involuntary and very uncomfortable. So abnormal diaphragmatic contraction with early closure of glottis, terminating inspiration. If the hiccup persists more than 48 hours, this is called persistent hiccup. And if it persists more than 1 month, then it's called intractable hiccup. So why this happens? What are the causes? The causes are usually related to the stomach or gastrointestinal system, such as esophagitis, gastritis, peptic ulcer disease, etc. Brain disease may be due to trauma, maybe due to tumor, infection, stroke. Renal disease, so uremia, may be associated with hiccup, and electrolyte imbalances such as hypokalemia, hypocalcemia may also cause this. Other causes include psychogenic causes and some drugs that irritate the stomach. How do you treat this hiccup? There are multiple treatment options, including the non-pharmacological options and pharmacological options. The non-pharmacological options include eating a teaspoon of dry sugar, Valsalva maneuver, and carotid massage, which will decrease the activation of the nerves, rebreathing into a paper bag. And you can also stimulate the oropharynx with a catheter. All of those have been tried, and some of those may be effective in reducing the incidence of hiccup. What are the pharmacological approach? The pharmacological management includes giving the patient PPI and prokinetic agents such as domperidone and metoclopramide. What are the other drugs? Some CNS acting drugs may be used in cases which do not respond with PPI and prokinetic agents, and those drugs include chlorpromazine, baclofen, gabapentin. Even you can use benzodiazepines and carbamazepine. In some cases, we can also use DEXA. Most of the times what we do, we use a combination of PPI, prokinetics, baclofen, and gabapentin. If all of those measures fail, what you can do, you can give the patient CPAP, and in very severe cases, the patient should be anesthetized. And obviously, you have to find out and treat the underlying cause.